am honored to address you at the first Health Scientific Conference of Nairobi County, and this gathering marks a crucial step in our journey to establish a healthcare system that serves every Nairobi resident with equity, resilience, and sustainability. As the County Chief Officer of Medical Services, I am privileged to underscore the critical role of research in driving sustainable healthcare improvements and to highlight the significance of this inaugural Nairobi County Health Scientific Conference.
We have 6 themes for this conference. This includes our commitment to health equity. It includes our commitment to integrate NCD services within our services, our commitment to community mental health initiatives.
I'm really happy today for this historic meeting, the first ever scientific health conference. As the Deputy Governor said, I'm also not a health professional, but I rely so much on the amazing team that you've seen here to deliver health services in Nairobi. I acknowledge all of you. I thank you for the tremendous work we've been able to do in the last 2 years.
The theme of your conference, Advancing Health Equity Towards Resilient and Sustainable People-Centered Primary Healthcare System for Nairobi, aligns perfectly with Kenya's development priorities, including the bottom-up economic transformation agenda and the Global Sustainable Development Goals, SDGs. One of the most pivotal sustainable development goals is goal number 3, which is good health and well-being, which aims at ensuring healthy lives and promotion of the well-being of all at all ages. This goal is central to today's discussions as it encompasses universal health coverage, health system strengthening, and reducing health inequities, priorities that this conference seeks to address.
And that includes policy, because even in policy, it's about engagement to come up with policies that serve Kenyans. And I'm sure the Nairobi County government does listen to us. And I can bear testimony to the fact that we contribute to bills. The changes may not always be what we want, but oftentimes we are invited to the table to make a contribution as to what we want.
I should be able to leave Kisumu, come to Nairobi, walk to a facility, give my ID, and OTP comes to my phone. I give it to the provider. They have access to all my medical records, which is where the digital transformation is going for. I should not be limited in where I can get particularly emergency care. If I'm a diabetic and I'm getting into a coma, I should be able to get that care anywhere.
It has been quite a challenge to enhance our health facilities and the services that we give, just because of the limited resources that we have.
Our generation, sadly, AI is where we are, and opportunities are abound. And we should also be realistic. AI is disruptive, seriously disruptive.
We haven't done anything similar even with our limited resources. So starting from health financing, we're struggling.
And we are glad glad to have you all. We are glad to have served you for the past few days, and we have learned a lot.
We mapped all the partners that we could work with because we didn't want this conference just for the county. We knew that if we are going to make any lasting impact, we need to have everyone on board, starting from the community, starting from all the actors in research, starting from all the actors in the private sector. You realize we had private sector representative because we need all the voices if we are going to advance forward.
If you don't have a team that is close and people who carry your vision, if you're not able to influence people to be able to carry your vision, then your work as a leader is very fruitless. I want them to stand with me on stage to inform me that, yes, I may have carried that vision, but they surrogated it.
We have 5 level 5 hospitals, and we also have level 4 and level 3 hospitals. So with this, we have a lot of data, health data, that when we come, we share together, we are able to make decisions and even influence policies.
This is a call to bring partners on board to engage with the county government and also to provide a platform where partners can talk to each other so that we can work holistically, so that we can provide better services to the wananchi.
It's also been very powerful in enabling us know the future and where the government is heading to with the whole aspect of guidelines, particularly on the new area of AI. And so we are looking forward to working together as partners to be able to inform the guidelines and policies that will all enable us work in an amiable and actually utilizing ethical practices as we utilize technology.
So this is really a great opportunity for us to come together from different sectors, different players from the academia, from the private sector, from the development space, from across the board, the civil society, businesses, for us to be able to put our minds together and really see how can we move forward in addressing some of the healthcare issues that we are faced with.